Good morning and welcome to New Jersey Viewpoint. I'm Ken Rosado. Today we bring you information on the enormous emotional toll that one can suffer when something called foot drop prevents getting around and living a normal life. We also bring you folks from the Adler Aphasia Center that serves people in the tri-state area. But first, we begin with a new weapon in the treatment of peripheral artery disease, also known as PAD. It's a common circulatory problem that can affect feet and lower legs and may lead, in some cases, to amputation. At St. Peter's University Hospital, they claim to be the first and only hospital in central New Jersey to have a fairly new device called a Lightbox. And our next guest thinks it's a game changer. Please join me in welcoming Dr. Zakir, who's a cardiologist, and he's the director of the Peripheral Vascular Program at St. Peter's. Good to have you here, Doctor.
Thank you, Ken. It's a pleasure.
So the Lightbox, we were talking off camera, is very beneficial for these patients who have PAD. In what ways? What are the ways that it's different and a game changer?
So these patients have very debilitating, what we call, the term is claudication, which is pain in their legs when they walk. So they could walk a certain distance and they have to stop and they have excruciating pain.
Because of the circulation that's blocked because of the arteries that are somewhat clogged.
Right. In about 40% of these patients, the arteries are totally blocked. And these could be very difficult to treat. Medications, which is our first line, and exercise often fail in these patients who have the total blockages, these long total blockages. And then when it comes to treatment approaches, you have a non-invasive approach with an endovascular approach, or you have a surgical bypass approach, which is very invasive. So the problem is that, in about 13 to 34% using our traditional approach, that's the failure rate when you have these long total blockages, and your complication rates can be significant when you're treating these long blockages. So what this device does, it allows us to see inside the artery. So it's got this OCT, this optical coherence tomography, which reflects light waves, and we get our image. So we're able to see inside the artery and navigate the catheter, away from the healthy tissue towards the plaque, and cross these blockages in a much higher success rate than the traditional approach. And we're able to do this, avoiding fluoroscopy, which increases our radiation levels, reducing contrast delivery to the patients. So we're able to have a much higher success rate. Once we cross the total blockage, then we can treat.
So to try to translate a little bit from what I was understanding, what you were saying before, basically you used to use X-rays and isotopes and things like that, which if you use that for a long time, could be potentially more harmful to the patient. If you use the isotopes with the dyes, that could hurt their kidneys, etc. And then basically, let's just try to use a real vernacular. You used to rotor-rooterize a little bit,
right,
up and down the artery, and sometimes you'd hit healthier tissue that didn't have plaque while you were going for the plaque part, and you could scrape and damage accidentally, right, the artery.
More damage to the normal vessel, again, because, without looking inside the artery, we really don't know exactly where we're going. It's kind of like navigating in the dark.
But in this case, you know exactly where you're going. You could see clearly without using the radiation, without using the dyes, the isotopes. You could stay there longer, and you could really pinpoint exactly where you need to go.
It's fascinating.
This is amazing.
It's great.
How does it do that, though? Is it basically a camera from the inside?
Exactly. They have there's a fiber on the tip of the catheter.
Wow.
Right.
That is brilliant. And where does it go in from the groin? You go in that way and go down?
Usually, yeah. Usually we go from the, when we're treating, say, if the patient has a total blockage in the left leg, often we'll access the right groin and the catheter flips over, or sometimes we'll go straight down.
And you go down and it's just...
And it's a small catheter, so these patients immediately afterwards, we often use a closure device, and they're walking 2 hours afterwards, and it's, they've had pain. On Monday I had a case where the patient had pain for 5 years, and then finally, he was referred over, and it's excruciating pain, really affecting his quality of life. And he had a long blockage, and we used the Ocelot, the Lightbox. We're able to get through, and then after that, we were able to break up the plaque and then put a stent, and now he's got brisk flow down his leg. Now, somebody that's had pain for 5 years and now is able to walk and enjoy life.
That is amazing. So you do this right after a cath lab, basically.
It's a cath lab procedure.
It is a cath lab.
Yeah,
so
it's a
just
cath lab procedure.
What they've been doing all along, basically, in a cath lab, if you had to put a stent in someone's heart, you're doing this in someone's arteries in their leg now.
Right. Instead of the catheter going up to the heart, it's flipping down into the legs.
This is brilliant. This is brilliant. You scratch your head and you say, why couldn't we have done this 10 years ago?
Right.
This is brilliant.
And that's a big change in how we're treating peripheral arterial diseases. We see a big increase in the endovascular procedures, and what's nice is we're seeing a big correlation with a decrease in amputations. So what we're doing is having a good effect.
And you just don't think about, in this day and age that people would need amputations, but sure enough, They surely would. And even, I would imagine, too, people who may not even feel the effects until later. People, especially, I would imagine, diabetics and people like that, too, who may not even realize.
Diabetics are, is a strong risk factor, and smokers. Those are the two biggest risk factors to develop peripheral arterial disease.
I would imagine that more plaques would develop in smokers, too, right?
Right.
This is something. Have you noticed at least a decline as people are becoming a little bit more health conscious, or is it still pretty high?
It's a growing, as patients age, also, that age is a risk factor. People, unfortunately continue to smoke despite all our, efforts to try to educate. So we're still seeing a fair amount of PAD. The prevalence is around 9 to 12 million in the United States.
And is it also, is there a factor involved in terms of now we have octogenarians and nonagenarians, we're living longer and longer, and does that have something to do with it?
It totally does, exactly. I mean, we have patients who, are much older, and again, if they're, cognitive, they're fine, they're still candidates for treatment because, again, we want to improve quality of life.
But it is nice to know that at least there is a way to have this done and get those arteries clear again without risking amputation and in a safe way. The Lightbox at St. Peter's. Thank goodness that you folks have that. Yes. It's good to hear. Doctor, thank you so much for being with us today.
My pleasure.
Our pleasure. We're going to be right back with a national marathoner who founded the Get Back Up movement after suffering from partial paralysis. Please stay with us.